Okay, good evening, everyone. I'd like to call the December 1st, 2020 meeting of the City of Yankton Health Board meeting to order. Just a reminder, because it's been a while since we've had a meeting, of who's all on the health board and who's serving. So we have Mayor Johnson serving on the health board. We have Dr. Mary Milroy on our health board, and myself, Amy Leone, I'm the city manager. Ex officio, so non-voting members on the health board include our city attorney, Ross Denherter, Dave Mingo, our community development director, Jason Foote, who is police commander in our police department, and Brad Beast, who is our code enforcement and FEMA manager, and just there's a long list of things that Brad does. We just couldn't sum them up in one title. So community development manager maybe is his accurate title. We're also joined by John Harris, who's the chief of police, and Al Barrick, our finance officer, has also joined us. So tonight we have a job to do, and that is to provide a recommendation to the City Commission for their special meeting tomorrow, which will be a first reading and introduction on a temporary ordinance relating to masking. So that language has been put on the city's website, and you were all forwarded that language today. Apologize for the brief notice, but there were some changes there that were made to the language. So what I'd like to do this evening is be able to come out of this meeting with a recommendation for the City Commission on where the health board stands in terms of what action they should take. Now, they won't be voting tomorrow night at their special meeting. That's not the intention of the introduction. Tomorrow at their introduction, they hear, it's a first reading, a first hearing of the ordinance. So we'll talk about the ordinance, and if they want to make any changes, if they want to revise the language or edit the language, they may do that. The public hearing will be set likely on December 9th, and that's when we'll hear from the comment from the community and all those things. So we'll talk about that more tomorrow at our first reading, but our job tonight is still to give them a recommendation. So I think what we'd like to do first is hear from Mayor Johnson and Dr. Milroy, and then hear from the ex officios, and then our guests, Al and Chief, if they have something they'd like to add for consideration on the recommendation. So Mayor, I'll let you give some comments if you have them.
I would actually turn it over to Dr. Milroy first, since she's the medical expert here.
Perfect.
Okay, thank you. I guess as a physician, I intend to urge that the health board do make a recommendation to the City Commission to pass a temporary mask mandate. I think we as a city are in a crisis situation right now. COVID-19 infections are climbing. Cold weather is here. The holiday season is approaching quickly. And I do think it's time to make the recommendation that the City Commission show strong leadership in stepping up at this time of crisis. I think that the medical evidence for the effectiveness of masks is very strong. It's increasing. Studies of even very high-risk exposures do show pretty consistently that there is at least a 70% decreased risk of transmission with the use of masks, and masks do protect both the wearer and those around the wearer. So I think that locally we have an example of this. I think the Yankton School District mandated a policy of mask mandate, social distancing, increased hygiene, and they are probably one of the most successful school districts in the state of South Dakota in keeping children in school. The goal was to continue in-school learning, and I really commend the school district and the school board for taking that role. And I think we have an example of how effective that can be. I think recently, just on November 27, the Morbidity and Mortality Weekly Report published a report that showed that in the state of Kansas, the governor issued an executive order for mask mandate, but did allow counties to opt out. And about 24 counties in the state of Kansas, which is, you know, maybe comparable to South Dakota in a rural kind of state. And in the counties that did stay with the mandate, they actually noted a 6% decrease in their COVID-19 incidents. There were 81 counties that opted out and just made recommendations, but no mandate. And those counties saw about a 100% rise in their COVID-19 infections. And that is just published very recently in a very reputable source. And so I think that does tell us that sometimes people just need that extra nudge, that the mandates really do help and they make a difference. I would say right now too, that hospitals, clinics, healthcare workers are absolutely overwhelmed and exhausted. I think Avera Sacred Heart and the Yankton Medical Clinic, as well as probably every healthcare facility in the city, is noticing that they have tremendous strain on their resources. I think the beds at Avera Sacred Heart, I heard, are becoming quite limited. If we don't do something soon, they will be in a diversion situation, which, you know, in all the years I practiced, I don't remember ever seeing that. So I think this is a highly unusual situation that does call for action. I think that even staff is exhausted. I think some of the PPE and supplies are becoming somewhat limited. And so I think we're teetering on a real crisis, and we should ask for this and ask the city commission to go ahead and pass the mask mandate. The South Dakota State Medical Association recently published a statement in support of a mask mandate. They also, I think just last Wednesday, the back page of the Yankton Press and Dakotan was the signatures of, I don't even know how many physicians in the state that were requesting, please do something to help our healthcare workers. And I can't even list the number of organizations that have signed on to the hashtag Mask Up South Dakota. So I think that there is widespread evidence that masks are effective and that they do definitely make a difference. I think our healthcare facilities and workers are really at the brink. And I think it is only prudent for us in this crisis situation to take a strong stand and recommend that a temporary mask mandate go into effect.
Well stated, Dr. Milroy. I've prepared some thoughts too, so that they make sense, and I say what I mean to say this evening. So, chaos. I think that's what sums up the messaging all of us have received around COVID-19 from elected officials at the state and federal level. After so much messaging chaos, do masks really work? How well do they work, etc.? Some people don't know what to believe and may just stop listening altogether. But if we listen to our health officials, there really is no question about masking. It works. The South Dakota State Medical Association, Avera Health, and the Yankton Medical Clinic have all taken the position of supporting mask mandates in communities where they are being considered. Why? Because the CDC and others have told us that they work. I'm quoting the CDC, experimental and epidemiological data support community masking to reduce the spread of SARS-CoV. The prevention benefit of masking is derived from the combination of source control and personal protection for the mask wearer. Adopting universal masking policies can help avert future lockdowns, especially if combined with other non-pharmaceutical interventions such as social distancing, hand hygiene, and adequate ventilation. So amidst all the messaging chaos out there, I think it's important for us at the local level to take a strong position to support what almost all public health officials are telling us. By doing so, we add clarity and legitimacy to the public response needed until we have widespread vaccines available. We are trying to motivate people to take actions at the individual level that will protect the community as a whole. That said, we're also trying to take a balanced and reasonable approach, and so it is imperfect. And so if you look at the ordinance that we've proposed, there are exceptions, and some of those are absolutely needed, such as cases where someone may have trouble breathing by wearing a mask. But others, people may question. And one I've heard a lot about is allowing patrons in bars and restaurants without masks. And I think this is an example of where we cannot let the perfect be the enemy of the good. In the spring, when we knew far less about COVID-19, there was a federal response that could provide financial relief to places like bars and restaurants that could not operate. That is nowhere near as certain now due to congressional inaction. So I can't ask someone to close their doors and possibly watch their livelihood disappear. As a city, we do not have the resources to compensate them. Instead, we encourage these businesses and their patrons to adopt the safest practices possible to reduce the risk for all involved. It's the best we can do, and it's a reasonable thing to do. So at the end of the day, I believe this ordinance provides clarity to our citizens on the best masking practices based upon what our health experts are telling us. It's the nudge in the back of our head to put on a mask before we run into the store or are going to be in close quarters with other people. It provides reasonable exceptions needed to make it workable in daily life. And most importantly, will help people move about our community with more assurance that safety precautions are expected and will be observed so they can shop, procure services, and enjoy recreational activities. This will help keep our community strong and help us get through what we all hope are the final innings of this pandemic. And for those who haven't seen the ordinance as it's proposed, there is no penalty being proposed, so there's no fine like you may have seen in other places. So as proposed, it would be similar to Sioux Falls, where they have an ordinance, which is law, but they don't have a specific enforcement mechanism. And I had a brief exchange with the mayor of Sioux Falls today to ask him how it was going. And he estimated that mask use has nearly doubled in the community since they passed that ordinance. And when it came to enforcement issues, because they expected many people to call with concerns about people not wearing masks, he said to date, we have only gotten 3 mask-related calls. That's good. So I think that shows that the vast majority of people appreciate the direction and will observe it because they know how important it is to the safety of our community as we wait for the vaccine. And that would be it would be my expectation that Yankton is no different than Sioux Falls in that regard.
Thank you, Dr. Milroy and Mayor Johnson. Ross, that's a good segue. The mayor's comments were a good segue. If you don't mind to thumbnail for the viewing public who may have not read the ordinance, just the Reader's Digest version. It is available to the public on our website, and it is, going to be part of the public packet to look at and read through. But just so they understand kind of the premises of the ordinance as it's currently written in draft form.
Sure. Thank you, City Manager. The ordinance, as it's written, starts with a definition section. It first defines what a face covering or a mask should be. And there are lots of examples, but essentially it's a device that must completely cover your nose and mouth without having openings, holes, or visible gaps in the design or the material to constitute an actual mask. And then the other major definition is what do we mean by premises that are open to the public? Because those are the places where masks must be worn under this ordinance. It's a very broad definition. It includes any location or entity that employs or engages workers, including all private sector entities, public sector entities, nonprofit entities, and every variety, regular commercial or business establishments, private clubs, and all public transportations, including taxis and ride-sharing vehicles. It's basically any place where people might gather that aren't in your own household. So it's designed to be as encompassing as we could be. And then moving on to the actual regulation, a face covering must be worn within the city of Yankton in all premises open to the public, and it must be worn properly in a manner that covers the nose and the mouth. So someone who's wearing a mask, but it's sitting, just covering their mouth, that's not going to be good enough under this ordinance. There is a demand that in addition to citizens wearing masks in places that are open to the public, the people who run those establishments also must enforce that requirement within their establishment. Nothing in the ordinance prevents owners of property or businesses from adopting and enforcing rules that are more strict than what we have here. Having said that, there is a laundry list of exceptions that we deem to be appropriate compromises where it's just not practical to wear a mask. And those exceptions include children under the age of 5, when we are seated at a public place to eat or drink, or while immediately consuming food or beverages. If you are receiving dental or medical care that prevents you from wearing a face mask during those procedures. If you are obtaining or receiving services that reasonably require the temporary removal of a face covering in order to obtain or receive the service. That would be certain hair salon or massage clinic type services. If you have a medical condition, mental health condition, or disability that makes it unreasonable for an individual to wear a face covering, or if you are engaged in swimming, showering, exercising, or team sports activities where the nature of the activity or the level of exertion makes it reasonably impractical to wear a face covering, provided that minimum social distancing of 6 feet or more is maintained at least to the extent possible, and provided that spectators, coaches, and non-participants do wear a face covering. We've got an exception for public safety workers actively engaged in a public safety role, including law enforcement, firefighters, or emergency medical personnel in situations where wearing a face covering would seriously interfere with the performance of their public safety responsibilities. There's an exception for those who are engaged in an occupation reasonably preventing the wearing of a face covering. I don't know exactly what that could be, but we have that exception in the situations where that would be reasonable. There is an exception for individuals who are asked to temporarily remove their face mask in order to verify their identity for lawful purposes. So that would be perhaps if you are pulled over, an officer is looking at your ID and they want to see your face. There's an exception if you're providing a speech, lecture, sermon, or broadcast to an audience or officiating a ceremony or religious service, so long as 6 feet of distancing for other individuals is maintained. There's an exception for those who are seated at a desk or standing at a stationary workstation, provided that the desk or workstation is shielded from the public or other employees by a solid wall or protective glass, plexiglass, or plastic barrier or partition. You don't have to wear a mask if you are alone in an office room, vehicle, or the cab of equipment or machinery, or in an enclosed work area. However, in such instances, the individual is recommended to carry a face covering to be used when the person is no longer alone. So that would be in my office, for instance. If my secretary were to walk in, I should put my mask on. You don't have to wear a mask if you're communicating with an individual who is deaf or hard of hearing, or who has a disability, medical condition, or mental health condition that makes communication with that individual impractical while wearing a face covering, provided that minimum social distancing of 6 feet or more is maintained to the extent possible. Then lastly, you don't have to wear a mask if you are playing a musical instrument that cannot be played while wearing a face mask covering, provided there is a minimum social distancing of 6 feet or more maintained at all times. So that's the list. It's not perfect. As Nathan indicated, we don't want perfect to be the enemy of progress or moving in the right direction. I can't remember exactly the expression, but this is strong guidance for the community to follow. However, there is no penalty if someone is not perfectly following these guidelines. However, all property and business owners are encouraged and directed to refuse service and turn out all persons refusing to cooperate with the terms of the ordinance, and enforcement assistance will be provided by the Yankton Police Department under existing laws applicable to trespass. So that is the enforcement mechanism that is already available under the law that we would like to encourage the public to utilize within each property owner or business owner's establishment to make this effective, because this will not be effective unless there's buy-in by the community and active enforcement by the property owners or the businesses that have the public inside their facilities. This ordinance is scheduled to sunset, meaning it will terminate of its own accord at 12:01 a.m. on March 1, 2021. So on the 1st of March, this will phase out. However, the commission does have the ability to suspend or reinstate the ordinance by resolution at any time before its expiration. So if we got a big batch of vaccines that we could spread around in the middle part of January, for instance, and the city was widely inoculated, we probably wouldn't have much need for this anymore. In which case the commission could take prompt action to suspend its enforcement and allow us to all get on with our lives as though COVID never was. But in the absence of that, it will remain in effect until March 1. But it is immediately effective, and under the law, immediately effective is relative, which means we would have to have a first and a second reading, approval by a majority of the commission, and then it would be effective upon publication at the Press and Dakota. So there's some delay in the effectiveness of this ordinance, assuming it passes at all steps. But that immediate effect is essentially referring to the fact that we don't have to wait 20 days after publication for the ordinance to take effect. So it will be effective as quickly as the law allows, which is a day after the second reading.
Ross, do you have anything else you want to add as an ex officio member of the health board?
I think that initially I had some heartburn over the fact that it's an ordinance without an enforcement mechanism, but the way that it came together, I actually really kind of like it. I think that we're reminding the public that while you won't get a ticket if you don't participate, we're empowering property owners, business owners to take advantage of the law that's already on the books. You can refuse service to anybody for any reason or no reason at all, as long as it's not discriminatory. And that's a powerful tool. And that is the way that we can, as business owners, can protect the public by enforcing it within our own walls. So I like the way that came together. It's an enforcement mechanism that's already there, but I think it helps to point it out so it doesn't ring as hollow as I thought it might when I drafted it. So that's my 2 cents. I think it came together pretty nice, and I think it's a good step for the community.
Thank you. I'd like to have Commander Foote, and then also if Chief Harris has something they would like to add, since you talked about the enforcement, Ross, if they could, if they have anything you guys would like to add, or if you have anything, you'd like to talk about in terms of the language is written.
So I really appreciate that there is no enforcement on this issue. I just saw that as going to be something that was going to be really hard for us to deal with. A lot of the language in there excludes a lot of people, and then how are we supposed to determine whether or not their exclusion is valid or not? That's a really tough position to put us in. I do like the businesses having that ability to refuse service, and they can call us on an issue of trespassing, which has more teeth than what I would think an ordinance for not wearing your mask would. I hope that the community realizes where we're at, and the fact that we all have a personal responsibility to ourselves and to our families to keep everybody safe, and then to our neighbors. I think it's really important to see that. I wish we wouldn't have to go to a mandate. I think that personal responsibility is what we should be using, and not really a mandate. But having the ordinance written the way it is, I think it will. I'm really seeing the benefit of this one.
Thanks, Jason. Chief, do you have something to add?
Yeah, I echo a lot of the things that both Ross and Jason have said about the thing. And in discussing this, not only with the chiefs in South Dakota, we also talked to the people in Omaha and in Kearney, Nebraska. And some of them have ordinances with teeth in them, and some of them have ordinances like ours that's being proposed. It's an ordinance, it's a law, but there is no teeth in it other than through the business. And all of them said that, generally speaking, by the fact that you have the mandate, that's the part that really helps them to keep the community safe. The much easier, as Jason said, for us to go and support a business who has the right to refuse service, and it doesn't become an issue then of, well, what is your medical condition? So we can say, no, the business doesn't want you in here trespassing, so you have to leave. And but the Omaha and Kearney, as of a week and a half ago, said that they actually issued no citations, even with a mandate. So by the mere fact that they were going there and talking to the people and the businesses supporting them, they didn't have to issue citations. So, and I do think that the mandate will help not only us, but even in our own city and even in my own department, show the importance of this issue. I think that Dr. Malray said that very clearly, that we need to make sure people understand this is not over with yet. And as the mayor said, we're coming up on a time when we're in the ninth inning, I guess, and let's hold out to the end. Let's not just quit early, let's make sure we carry it out till we get the vaccine. So I guess that's my thoughts. And I appreciate what you're trying to do. It does put everybody in a spot, particularly the elected officials. So we'll support whatever you come up with.
Thanks, Chief. Dave Mingo, Community Development Director, do you have anything you'd like to add?
Yeah, sure. As Chief Harris said, as staff, we'll support the commission's decision a week from tomorrow, and work with whatever the provisions of the ordinance are. I'd like to take a little bit of a minute here, or a few seconds, just to add a little bit of a different slant to this whole discussion, and that is, I've been around a long time. I've been fortunate to be an employee of the city for a long time, and roll the clock back 9 or 10 months, and I would say Yankton was in a position where we were working as collaboratively as we ever have in our history. We had so many different individuals and entities working together. And I'd like everybody just to keep that in mind as we move forward with this. This seems to be one of those issues that's extremely divisive, and believe whichever side of the issue you may. I just hope that people can compartmentalize this discussion from the rest of what we've been working on, over the last year or so here, that have been so productive and proactive in our community.
Thanks, Dave. Brad, would you like to add anything to community development perspective, code enforcement?
I think anything I would say would be repeating what Dave and others have said before me. I don't have anything new to add to the conversation.
All right, thank you. We do have another guest here who has some experience. Al, do you have anything you'd like to add either about the content of the ordinance or the process, or even just your perspective? We would value that as well.
About the only thing I'd add is echoing what Dave Mingo has talked about, that it has become such a divisive issue nationally, and we have so much division anyway right now, that I think it's important for everybody to remember that whatever the majority decides, we all just need to accept it instead of fighting it. You know, the only way it'll work is if all of us work together.
That was a good reminder. That's Al Barrick, our fearless finance officer. Should add that. Anybody else have anything they'd like to add? Otherwise, I think you know, we're ready to develop our recommendation, and we can certainly take a vote if you'd like to do that. I did think I saw one of our other folks, Katie Huff, on briefly, but I think she dropped off, so she must have had something going on. Dr. Milroy, did you have something else you'd like to add?
No, the only thing I would say is I've had a number of people talk to me, and I mean community members, urging that something be done about masks. And one of the things, the comments they said was, economically, if they go in a store or they consider going to a store and it's mixed, a lot of non-masks in evidence, they're going to order on Amazon, but they would prefer to support the local businesses. But they are uncomfortable with going into stores unless people are masked. So I actually think economically this would be a good thing for the city, and people would feel more safe and more inclined to shop locally and utilize our businesses.
Thank you. I'm not seeing any other microphones go on. Just for the public's benefit, I will and let them and the rest of the health board know that my role as the city manager is to fulfill the direction of and the decisions of the city commission, and to be that liaison to the community regarding the policy directives that they take. So that's what we're doing right now. We're following the direction that was given to us last week at our city commission meeting.
Harris, Mary, can you go on mute, please?
There we go.
That's better.
Yeah. Would you like me to restate, Mayor?
Yeah, I think we lost a lot of that. Sorry.
Sure. So just for the public's benefit and for the rest of the health board here, my role as the city manager is to carry out the decisions and directions of the city commission and be that liaison between the commission and the community regarding their policy directives of the city commission. And presently right now, the staff and I are carrying out the direction that was given to us last week by the city commission based on a vote that was taken in April on a resolution. And we talked about that last week. So I will continue to do that regarding the city commission's policy directive. So we'll find out what that is likely on December 9th. And so I will abstain from the vote of the recommendation. So I won't make a motion and my vote will be an abstention. So I would look to either you, Mayor, or Dr. Milroy to make a motion, and I'll field the vote.
I would make the motion that we recommend the ordinance as proposed to the Yankton City Commission.
Dr. Milroy, do you have a second on that motion?
I know she had to step away for something around 5:30, so now's probably the time she stepped away momentarily.
They're building an Optimus float in a garage for the parade.
Well, that's optimistic. I guess we should have all been more abbreviated than in our comments. I think we can presume what Dr. Milroy's vote is.
Hi, I'm
there
back
she is.
on. Sorry, I had to step out for a second. I'm trying to be two places at once.
Well, we know the feeling. Dr. Milroy, Mayor Johnson made a motion to.
I'd be delighted to second that.
Okay. Thank you. His motion was to propose to the city commission that they pass the resolution, or excuse me, the ordinance as written. And Dr. Milroy has seconded that. So because I know we have, I'm going to do just a quick voice vote here. Mayor Johnson, you vote aye or nay?
Aye.
Dr. Milroy?
Aye.
And Amy Leone's vote is an abstention. So with that, we will recommend to the city commission that they move forward with the mask ordinance as it's currently drafted. So that is the decision of the health board, and that's what will be recommended to the city commission tomorrow evening. That meeting's at 5:30. There will be a first reading / introduction of the ordinance. So what will happen at that meeting is very much some of the same things that happened tonight. We'll talk about this recommendation that the health board made. I'm guessing that the city commission would like our city attorney to step through the ordinance and the language. We will also likely have some questions from the commission to health board officials and possibly other staff. We'll answer those questions the best we can. We will then also take any direction from the commission if they want to change some language, so they can tweak and change the language as well. So if they'd like to do that, we will take that direction, and then we will set a second hearing. So the second hearing will be the time for public comment, and people can come to the meeting tomorrow at 5:30 at the CTME meeting if they would like to listen, or they can participate by listening on YouTube, on our YouTube channel, like they're listening this evening. We will not take public comment on that item, but we will have a time for public appearances. So is there any other business to come before the health board that anyone would like to mention?
Amy, can we tell people the email address where they can begin submitting feedback on this now if they want it, or through till next week if the commission introduces it and sets the second hearing tomorrow?
Sure. So we will be taking comment between the two hearings, the first and second hearing, and we'll collect all those and give them to the city commission for two reasons: to give more access for folks if they want to participate, but also if somebody doesn't want to physically come to the second hearing, because we do want to limit, right, the amount of congregating that we're doing. They can submit their comments on email, or handwritten comments by mail. So by email, that address is commission@cityofyankton.org. So again, commission@cityofyankton.org.
Hey, Mary, can you go on mute, Mary?
Yes.
Sorry, you're cutting in quite a bit. There you go.
Okay, so that email for public comment on this topic is commission@cityofyankton.org. Again, that is commission@cityofyankton.org. We'll collect all those comments, and you can make those comments anytime. We'll collect them all, and they'll be made part of the public record for that second reading, which will likely be on December the 9th. We'll get all that information. Alternatively, if you don't want to email, you can handwrite a letter, snail mail, and the address you want to send it to is City Hall, Attention City Commission, and that's P.O. Box 176, 416 Walnut Street, Yankton, South Dakota 57078, and we'll take those, scan them into part of that all the email collected comments and get them to the commission. So those things will be part of the decision-making process. If you've already sent something to the city, whether that's a letter or an email in the last 30 days, we will include that in that comment. So you don't need to resend that or resubmit that. We do have some letters that have been given to us as part of the work session meeting last week that people wanted to give the commission. So we'll resend those and make those part of the public record as well. So and we'll talk about that too tomorrow night. So people will reiterate that so people understand. And I hope that by tomorrow evening, we'll have more clarity on the meeting on December 9th, be able to state a time and be able to talk about location and participation in that meeting.
We have one question on YouTube Live about where the ordinance can be found again. So if we want to restate that, and then I'll also respond to it in the chat.
Certainly. So it is on our website now, on the City of Yankton website, under the Health Board information. I will also be, after we adjourn, one of my calls was going to be to Mr. Bees to ask him if he would post it on the draft language on Facebook with the Health Board recommendations so that the public could see that. So that might be the easiest way for that individual to access that. Brad, is that something you could help us with tonight?
Yep, when we adjourn, that's what I'll be doing, and it'll also be available on the commission's portion of the website as well, again, as quickly as that can happen.
Yes, and I will notify the commission of the recommendation as well in case they're not watching or not on the social media, but the Facebook might be the easiest way, Dave, for that individual to access that language.
And I don't know if you mentioned this in your comments, Amy, but part of the reason there's a question about the venue for next week is because we are hoping to secure a larger venue to accommodate anyone who wants to show up and provide feedback and feel that they can do so safely. So there can be social distancing.
That meeting on the 9th will not take place at the CTME. We're working on a venue right now and timing and the technology involved. So all those good things. I will say that, we don't want a big public gathering of any kind, but if we have to have a public gathering where people are congregating, we'd like to give people the space that they need to social distance. We will be requiring, a face covering because there is an accommodation if you're not wearing a face covering to be able to participate remotely. So we're working on all those things. We're going to get information out to people. Facebook is a great way to keep up on that information. You can also contact us at City Hall. We want to make sure people are informed. We just have to also ask for the community's understanding that, we have to be careful to protect each other too while we're conducting the city's business. So we want to be cognizant of that. And I think a great way to get your voice heard and to be part of the public record is to submit those either electronically or in the mail. So hearing no other business for the Health Board, I think that I can just state that this meeting is adjourned at 5:47. I'll try to get some minutes put together and get those posted as well for people that aren't watching live.
Thank you.
Very good. Thank you.
Thanks everybody for your time, and we'll speak with some of you tomorrow evening.
Bye, guys.